We have 4 pharmacology talks for you this afternoon. I'll be giving the first one. I think I've probably met most of you about an hour ago for the antibiotics talk. Here I am again. So I'll be talking today about anticoagulation in the hospital. This is primarily a talk that I'll focus a lot on the novel oral anticoagulants, but we will touch on some of the parenteral anticoagulants as well, just for completeness sake. And then I'll have a few pharmacology pearls sprinkled about this presentation for you. I have no relevant financial relationships to disclose. Nobody pays me anything for this. 3 objectives for you this afternoon. First is to review the indications, pharmacology, and evidence supporting the use of novel oral anticoagulants. We'll, by use of a case, select an appropriate oral anticoagulant for a patient. And then lastly, we'll identify candidates. We'll talk a little bit about bridging. So we'll identify candidates for bridging therapy during interruptions in oral anticoagulation therapy. So I wanted to start off with this nerdy timeline of anticoagulants. And so back in 1884, somebody very smart discovered that there was an anticoagulant in leech saliva. And so that anticoagulant actually turned out to be a direct thrombin inhibitor, interestingly. It wasn't until 1918 that heparin was discovered by researchers at Johns Hopkins University. Fast forward another 23 years or so, and the patent was awarded to the Wisconsin Alumni Research Foundation, so WARF. And then the arin comes from the compound coumarin, so warfarin is sort of the product of that discovery. And then in 1960, we completed the first clinical trial that showed benefit of heparin in patients with a pulmonary embolism. Fast forward to 1993, and there are low molecular weight heparins available, so enoxaparin and a couple of others. And then it wasn't until 2010 that we have the first quote, novel oral anticoagulant available that is acted directly at a single target. So I just think it's interesting that the first point in this timeline was a direct thrombin inhibitor, and then in 2010 we've come full circle when dabigatran, being the first NOAC approved, was also a direct thrombin inhibitor. So kind of coming full circle there. I was wondering if I should bore you with pharmacology, but this is a pharmacology section, so I will bore you with pharmacology. So this probably brings back painful memories from any pharmacology class you might have taken. This is your coagulation pathway. So obviously warfarin, we're inhibiting the vitamin K dependent clotting factors that are highlighted here. And where these new